Ever stubbed your toe on the coffee table?
Yeah.
That sharp pain, right? Or how about when a kid falls off their bike and they're in tears?
Mm-hmm.
We all know those pains instinctively, you know.
Yeah.
But pain, well, it's way more than just everyday bumps and bruises. It can be so complex, chronic even. So today, we're going to take a deep dive into the world of pain management
Okay.
for everybody, adults and kids too.
I like how you started with those everyday examples because pain, it really is woven into our lives, isn't it? We
Yeah.
focus on that ouch moment, but pain is so much deeper than that. It's a blend of physical sensations, emotions, our thoughts even.
Yeah. I've always wondered, like, how do doctors even define pain?
Right.
It's so personal. It's subjective, right? It's almost like trying to, I don't know, measure happiness.
You're right on the money. Pain is truly whatever the person experiencing it says it is. And that's exactly why healthcare providers consider so many different aspects of pain. How intense is it? What type of pain is it? Where is it? What triggers it? And how is it impacting your daily life? It's a multifaceted problem.
So how do they navigate that? I mean, is there like a roadmap they follow, especially when it comes to treatment?
Well, there are guidelines. The World Health Organization, they have this thing called the pain letter,
Okay.
and it helps doctors kind of systematically approach managing pain.
Oh, I
Think of it like climbing a ladder. You start with simple pain relievers, over-the-counter stuff, and then you might move up to stronger options, combining medications, or maybe even, for severe cases, considering opioids.
Okay.
But it's not, one size fits all.
Right.
It's
Yeah.
a guideline that's adapted for each person's needs.
So the pain ladder really helps tailor the treatment, right, to the individual's experience of pain. What are some of the, I guess, challenges that doctors face when they're trying to apply this?
I think one of the biggest challenges is finding that balance between, giving someone relief from pain, but also avoiding the potential downsides that can come with treatment. Like medication might not work for everyone, or it could be hiding a bigger problem that needs to be looked at. And then there's side effects, of course. And with certain medications, especially things like opioids, there's the risk of dependence or addiction.
It sounds like a very delicate balancing act.
Yeah.
And I'd imagine the communication, right, between the patient and the doctor plays a huge role in getting the treatment right.
Huge.
Yeah.
Absolutely. Yeah. If a patient can't properly describe their pain, or if a doctor isn't fully understanding what the patient is experiencing, it can lead to a lot of frustration and ineffective treatment.
Yeah.
So open, honest communication is super important to navigate all of this.
Okay, so medication's obviously a key part of the pain management toolkit, but I'm curious, are there other approaches out there
Yeah.
beyond just pills?
You bet. Focusing only on medication, that would be like looking at one tiny brushstroke in a giant painting. There's a whole world of physical and psychological approaches, and those can be incredibly effective.
Yeah.
Sometimes even more so than meds on their own.
So what are some of these alternative approaches beyond the pills, I mean?
Well, let's start with some physical approaches. You might be surprised to know that the CDC, they often recommend physical therapy and exercise as a first-line treatment, for lots of types of chronic pain.
Really? Exercise for pain? That seems a little counterintuitive. Wouldn't that just make things worse?
I know, it seems that way. But think about it. When you're hurting, you tend to avoid moving around, right? And that can actually lead to weaker muscles, you get less flexible, and then, even more pain. But exercise, that can help strengthen those muscles, improve your range of motion, and it releases endorphins, those natural mood boosters.
So it's not about, like, pushing through the pain, but using movement strategically.
Exactly. It's about giving people that control,
Mm-hmm.
to take an active role in feeling better. And there's another interesting physical therapy technique. It's called transcutaneous electrical nerve stimulation, 10NS for short.
10NS. Huh. How does that work? I mean, how does that relieve pain?
It's based on this really cool concept called the gate control theory of pain.
Okay.
So 10ENS, it uses this little device, and it sends these gentle electrical pulses to the skin near the area that hurts. And those pulses, they're thought to close the gate on the pain signals that are traveling to your brain. So you're basically blocking them before you even feel them as pain.
Wow. So it's like intercepting the pain message before it gets there.
Yeah.
That's fascinating. What about alternative therapies like acupuncture? I've heard so much about it,
Yeah.
but I've always been a bit skeptical.
Yeah, acupuncture is an ancient practice where they insert these thin needles into specific points on the body.
Right.
Now, the scientific evidence, it's still being researched.
Oh, yeah.
But lots of people find it really helpful, especially for chronic pain. The thought is it stimulates the release of endorphins and other pain-relieving chemicals in the body.
So it might work differently for everyone, like,
Yeah.
based on their experience of pain. We talked about exercise, TNS, acupuncture. What about light and sound therapy? Where do those fit in?
Those are, they're kind of newer areas of research,
Yeah.
and they're showing a lot of promise, especially when you combine them with other approaches.
Yep.
Light therapy uses specific wavelengths of light, and it helps stimulate healing and reduce inflammation. You know how sunlight can make you feel better? It's kind of like that.
Right.
And then sound therapy, well, it uses specific frequencies and vibrations to influence brainwave activity, so it helps people relax, which can be really good for pain management.
It seems like we're really just at the beginning
Yeah.
of understanding how those can be used.
Yeah, we are.
It's incredible how much research is being done in the whole field.
It is. And we haven't even touched on the psychological side of pain management,
Right.
The mind plays such a big role in how we experience pain and how we deal with it.
Yeah.
In fact, sometimes if you address the psychological stuff, it can be just as effective as addressing the physical.
Now that you mention it, I have heard a lot about therapies like CBT being used for chronic pain.
Right.
How does that work exactly?
Well,
I thought CBT was usually for, mental health conditions.
yeah, it is. It's often used for things like anxiety and depression, but it's also really powerful for managing chronic pain. It's all about understanding how our thoughts, emotions, and behaviors, they can all impact how we experience pain.
So instead of just focusing on the physical sensation of pain, CBT helps you address, like, the mental and emotional parts of it too.
Exactly. For example, if you're always thinking, this pain will never end, or I can't do anything because of this pain, those thoughts can actually make your pain feel worse.
Yeah.
So CBT helps you recognize those negative thought patterns and challenge them, swap them out for more helpful ones.
So you kind of learn to reframe how you think about the pain. But what about if you can't just, think your way out of the pain?
Mm-hmm.
What about those cases where the pain is very real and it's really hard to live with?
That's where acceptance and commitment therapy comes in, ACT. It's a different approach.
Okay.
So instead of trying to fight the pain or get rid of it completely, ACT encourages you to accept it. It's part of your experience, right?
Right.
And then you can focus on living a meaningful life, a full life, despite the pain.
So it's more about shifting your focus from eliminating pain to just living a good life,
Yeah.
even with the pain.
Right.
That's interesting.
It can be really empowering for people who've been struggling with chronic pain for a long time. And then there's another fascinating technique, hypnosis.
Oh, wow.
It's been shown to be especially effective for pain management, particularly in children and for procedures. Basically, you induce this deep state of relaxation and focused attention, and that can help reduce how much pain you feel.
Hypnosis. I've always found it so intriguing.
Yeah.
It seems like something out of a movie.
It might seem mysterious, but there's more and more evidence that it works.
Yeah.
And then there's mindfulness and meditation, right? They've gotten super popular lately because they can help manage pain.
I've heard about those too.
Yeah.
What makes them so effective for pain management?
Well, they both help you become more aware of your thoughts, your feelings, and your physical sensations.
Yeah.
But without judgment,
Right.
So instead of resisting the pain or getting caught up in it,
Yeah.
you learn to just observe it
Okay.
with a sense of detachment. And that can really reduce how intense it feels.
So it's not about getting rid of the pain altogether, but changing how you relate to it.
Mm-hmm.
This has been so enlightening, honestly. If we got from the basics of pain, what it even is, to all these different ways to manage it, physical therapy, medication, and these fascinating psychological techniques. But I'm wondering, how does this all apply to children? I mean, treating pain in adults is complicated enough, but kids, that seems like a whole other ballgame. Yeah, you're right. Treating kids' pain, that's a whole other challenge. It's like you're trying to figure out a secret code.
It really is, especially with the little ones. They can't always tell us what's wrong, can they? So figuring out their pain, it can be tricky. Like imagine a baby that can't talk yet.
Right.
You have to rely on these tiny little clues.
Yeah.
Like their facial expressions, if their behavior changes, even how they cry.
It's like detective work for the doctor almost.
It is. And then there's the fact that pain scales, those assessment tools, you got to adjust them for age.
Oh, of course.
What works for a teenager won't work for a toddler. It's like needing a whole new language depending on how old they are.
And I bet there are so many misconceptions out there about kids' pain.
Yeah.
I've heard people say babies don't feel pain as much, or they must not be hurting if they can sleep.
Yeah. Those myths are everywhere, and they're so wrong.
Yeah.
The reality is, babies, they've already got those neural pathways developed for feeling pain.
Wow.
They experience it just as strongly as adults do. And as for the sleep thing, well, kids are often just plain exhausted from dealing with the pain. They're worn out. So they end up sleeping because they're so tired, not because the pain is gone.
That's sad to think about, but
Yeah.
important to know. So how do you even approach managing pain in kids with all these challenges? It seems like it would need a much gentler approach, more intuitive.
You're spot on. When it comes to treating children, the focus is on something we call atraumatic measures. Basically, it's all about reducing stress, making things as calm as possible, and giving kids a sense of control during procedures or treatments. So, for example, we might let a parent stay with them, use a special room instead of their hospital room, give them choices whenever we can, and even use distractions to take their mind off things.
Those are all such good ideas.
Yeah.
What about the non-pharmacological stuff?
Right.
I feel like those would be especially helpful for kids, since medication might not always be the best route.
Absolutely. We've got a whole bunch of creative techniques for kids. For babies, swaddling and kangaroo care, that skin-to-skin contact can be really soothing, and distractions work wonders. Singing, telling stories, even blowing bubbles.
Wobbles, that's amazing.
It sounds simple, but it works. And
Yeah.
then there's play therapy. It's fantastic because it lets kids act out their feelings and worries through play.
It's all about connecting with them on their level, right?
Yeah.
Meeting them where they're at.
Exactly. Now, medication, it does have its place, but we're much more careful with it in kids.
What are some of the, I guess, things you have to think about when it comes to medication for children?
Well, opioids, for example, especially in younger children, we have to be really cautious with those. They carry a higher risk of complications.
Okay.
So we always try non-opioid options first whenever we can, and we keep a close eye out for any side effects.
It seems like treating pain in children is a real art form.
Yeah.
You need the medical knowledge, but also that understanding of how kids develop and a lot of compassion.
I couldn't agree more. It takes a special kind of awareness, being able to see the world from a child's point of view.
Well, this has been an amazing deep dive into the world of pain management. We've learned so much. Pain is more than just that initial ouch. It's this whole mix of physical sensations, emotions, thoughts, and we've explored all sorts of ways to manage it, from medication to physical therapy to these incredible psychological techniques. And of course, we talked about the specific considerations when it comes to kids and pain.
It's been great exploring all of this with you. Pain is something we all experience, but we don't often talk about it in this much detail.
That's true. And I think you've given our listeners a lot to think about. What's the one question you'd want them to walk away with?
If pain is so subjective, so unique to each person, is there a way to understand it better?
Interesting.
Is there a common language of pain that we can all learn, both for ourselves and for others?
That's a powerful question, one that I think we'll all be pondering for a while. And to our listeners, if you're dealing with pain, whether it's your own or your child's, remember, you're not alone. There are so many options out there. And sometimes finding what works best is a journey in itself.